For this video, I'm going to show you how to take out sutures on a patient. This is a anatomically correct model that we have for the vet students to practice their suturing skills. So this signifies the muscle layer. This is the subcu fat, and then you have your tissue layer, and then we have our sutures right here. And the supplies that we'll need is suture scissors, and then just Edson Brown forceps. So first of all, we want to make sure that the clinician looks at the incision site. First, you want to look for any redness, any irritation, any painful, any pain along the incision site, any swellings. You want to make sure that they don't have any seromas or anything else going up underneath the subcu tissue before you go ahead and remove your sutures. Once your clinician is fine with you to remove the sutures, first what you're going to do is you're going to have your patient lay in lateral recumbency, and your patient will be thoroughly restrained just so they don't cause any harm to themselves. And this procedure is very painless. It's just a little bit more stressful on animals just because of the restraint and then the unusual pulling feeling that you're as you pull the sutures out. So what you want to do is you want to, with your forceps, lift up your sutures, get up underneath, snip, and then pull your suture all the way out. You're going to do the same for each. You want to make sure not to injure the skin up underneath. You want to make sure not to have any, you don't want to cause any tissue damage. And you just want to make sure that all of the suture comes out, that none remains in the skin itself. Okay, and then once that's complete, then you're going to go ahead and you're going to look in the incision site, and the incision site should be completely healed. You shouldn't have any gaping openings, so it should be completely healed. And then what you'll go ahead and do is mark down in the patient's records that you removed. This was, I believe, 9 sutures off of the abdominal wall or thoracic wall or wherever you're going to remove, whether it was a toe mass or anything like that, and that there was no complications with the procedure and the incision site looked good.